We realized the pandemic would have a mental health impact just because of the sheer magnitude of people impacted and all of the various ways that the pandemic has touched people's lives. So from people being diagnosed with COVID and the stress related to that, people passing away, all of the grief and loss and disappointment, all of the milestone life events that couldn't be celebrated in the usual ways have really made things very, very difficult. Unfortunately, the mental health impacts have only become more apparent and more pronounced over time. Symptoms of anxiety, depression, post-traumatic stress, increased numbers of folks that are saying that they are using substances more than they had been previously or have started using substances as a way to cope with the stress, increase in reports of suicidal ideation, child abuse and neglect, senior abuse and neglect, people that have lost their housing. I think it's really important to note that these risks for mental health consequences are not equitably distributed across the populations. For a lot of people, there's going to be, I think, a very long tail on the impact of COVID-19, even if they did not personally have COVID-19. The aftermath of this is going to be similar to the aftermath of other types of natural disasters in some ways. Most disasters are much shorter term. And so thinking about recovery, it's in the weeks and months immediately after the event, and sometimes years if it's rebuilding an entire community. But this is, sort of a collective trauma that's been ongoing now without a definite end in sight. Although our team is at the National Center for PTSD, which is part of the Department of Veterans Affairs, part of the VA's fourth mission is for helping the nation address issues in times of disaster. Our team had been watching news come out of China and Italy, and we realized that there were going to be mental health consequences. And so we started working on creating a mental health resource. Our COVID Coach app includes interactive tools for managing stress and coping with anxiety. The app also includes ways for people to self-monitor mental health symptoms, so things like depression, anxiety, PTSD, as well as public health resources for staying safe from COVID-19. And lastly, we included a lot of resources to help people connect with services and social support for things related directly to mental health, but also for things like meeting your basic needs. How do you find a food pantry? A place for people to find reliable and accurate information. COVID Coach can be downloaded from both the Google Play Store and Apple's App Store. You don't need to enter your name. You don't need to enter an email address. You can just download it and start using it. We take data security and privacy very, very seriously with all of our apps, in part because we know that there is stigma around mental health. We have a custom-built solution where a installation code is assigned the first time that the user opens the app, but that code is not linked to anything unique about the user. It's not based on their device ID. It's not based on anything else that can be tracked. We do have some knowledge of how people are using the app, but we don't know who is using the app. We are using the anonymous usage data to make the app better and make it more engaging. We're looking at what people are using the most and finding ways to showcase that. We're looking at what predicts return usage. People are using the managed stress tools the most in COVID Coach, and I think that this is not surprising to us. From design choices, it's in an area of the app that would get the most attention in the upper left quadrant. But also the app was promoted as a way to help manage stress and cope with the pandemic. Drawing on apps that our team had previously made, we started at the end of March and we released the app at the end of April. And we've been incrementally updating it over time with new information and new content. My background and training is as a social psychologist, and I primarily work with clinical psychologists, but we work on a very multidisciplinary team. Partnering with technologists and engineers, I think, is so crucial for thinking through solutions for not just this pandemic, but the future, so that we're better prepared to address these kinds of challenges. COVID coach is not a treatment. It's not a way to diagnose anything, but it may be an important first step in people understanding that there is a problem and finding ways that they can connect with resources